One of the difficulties with this topic is it's a very sensitive topic, and a lot of women will not bring it up. They're either embarrassed or they just don't like talking about it. They've lived with it for so long. But when I find what I've added into my template for new patient visits is, if I do a quick visual screen and I think their breast size might be relevant, I'll ask them, what's your current bra size? Do you feel limited by your breast size in any way? And oftentimes that's enough of an opener that if they have a suspicion that it might be contributing to their chronic pain, they'll readily bring it up. Or they'll already tell me they have been evaluated for it in the past. But it's a trickier procedure because it can impact a woman's ability to breastfeed. So for the migraine population, which tends to be women between their 20s and 40s, kind of peak prevalence in those decades, it's not a procedure that you can just willy-nilly go obtain, because if you're planning on having children and want to breastfeed, it's really not ideal until after you're done with your childbearing years. But I do suspect it in a number of women, and I've gotten really positive feedback on my research from women with chronic head and neck pain disorders. So I generally will tell patients if they have other symptoms that have been shown for decades to be helped with surgery. So chronic neck pain, back pain, pinched nerves in the neck or back, is really impacting their social life. A lot of women with macromastia literally can't find clothes or bras that fit or support them. They don't work out because of how painful it can be from the mobility or what's called the breast slap, the breast moving up and down with aerobic exercise. So if it's really impacting their life, I oftentimes will refer them to plastic surgery to have that conversation. If it doesn't have a huge impact on their life, and there are a lot of conservative options left still, like migraine therapies, physical therapy, supportive bras. I've learned in my research in working with the plastic surgeon, there are actually medical grade bras for women with really large breasts that you can get through a company that manufactures durable medical equipment like CPAP machines. They also, I'm sure they're not beautiful bras, but for women with really large breasts, I, double I, J, double J, you're gonna have a hard time finding those bras in Nordstrom. So there are typically women in headache clinic have not tried a lot of things. They haven't tried physical therapy. Most women have not been formally measured for a bra within the last year. If you read the literature on women and bra sizes, most papers suggest that between 75 and 100% of women are not wearing the best bra size for them, so they're wearing ill-fitting bras, just because weight fluctuates so much from year to year throughout a woman's life that we often try to get as many years out of one bra we can when we shouldn't be. So there are a lot of kind of conservative interventions I would recommend to women prior to surgery, but there are women that are severely impacted by it. You can get a severe rash disorder called hidradenitis suppurativa, which is just this inflammatory kind of follicle or boils that can develop in areas that become really hot, humid, like armpits or under the breast. In like summer months, hot, humid summer months, women can get fungal rashes, and it can just become a really painful process. So if women have a lot of severe symptoms, they're normally pretty forthright about that. And I would always say if there are severe symptoms, I would refer them to plastic surgery. But if it's just for headache, I'm not there yet to refer women, because we have so many non-surgical options for headaches, like medications, therapies, neuromodulation devices, before it would involve a surgical procedure like removing your breast tissue, which can be viewed as pretty serious.